Diabetes is a disease affecting millions every year. Although there are different causes and symptoms for diabetes, what is actually happening inside of someone who has diabetes? First, let's see what is supposed to happen inside of the body. Whenever you eat something, especially carbohydrates or carbs, the body breaks down those carbs into glucose, a form of sugar. During this digestive process, the glucose that is broken down enters the bloodstream, increasing blood sugar levels. Now, an organ part of the digestive system called the pancreas has pancreatic beta cells, which are able to sense blood sugar levels. In the case where blood sugar levels are high, the beta cells sense it, so the beta cells in the pancreas then produce insulin. And insulin is a hormone or regulatory substance in charge of redistributing glucose throughout the body by signaling cells to take in glucose from the bloodstream and use the glucose as energy. The liver also takes in glucose and stores it as glycogen. A response also occurs when blood sugar levels are low. Cells called alpha cells inside of the pancreas produce a different hormone called glucagon. Like how insulin helps lower blood sugar levels, glucagon does the opposite and helps raise blood sugar levels by signaling the liver to break down glycogen into glucose, releasing in the bloodstream and thus raising blood sugar levels. This whole process of maintaining blood sugar levels represents a negative feedback loop, which is a regulating mechanism that occurs to counteract change and maintain a desired equilibrium, also known as homeostasis. So, what will the body do if blood sugar levels are too low? It will find a way to increase the blood sugar levels, and typically that way is producing glucagon using the pancreas. The same thing happens if blood sugar levels are too high. It will find a way to try to lower the blood sugar levels. However, what is happening in type 1 and type 2 diabetes? For type 1 diabetes, there is a lack of insulin production due to a loss of beta cells. This loss of beta cells typically occurs due to an autoimmune condition, in which the immune system automatically destroys beta cells. And like I said before, beta cells inside the pancreas are what produce insulin. This may also be the case for more severe type 2 diabetes cases. However, type 2 diabetes occurs due to something called insulin resistance. Insulin resistance is when the body resists the effects of insulin or is unable to produce enough insulin to maintain normal blood sugar levels. So, if cells aren't accepting insulin, then they won't properly take in glucose from the bloodstream, causing disruptions to this negative feedback loop process.